So today we're talking about male breast excision. In most plastic surgery offices, including ours, 90-95% of our patients are women. So it may not be easy to understand for women, but every plastic surgery that we do on a man or a woman, it's about yourself. It's about feeling better about yourself. So women, if you look at a guy and go, there's nothing wrong with his chest, I don't know why he needs that. Men say the same thing about women. But when you do plastic surgery, you do it for yourself. That's the best reason to do it. Not for someone else, not to get a better job or something like that. You do it for yourself so you feel better about yourself. So male breast excision, a lot of men have, well, both men and women have breast tissue. It's just men have a lot less. The larger a man you are, especially if you have more fat, the more breast tissue you have. There are a few conditions where you get extra breast tissue. All men going through puberty get extra breast tissue, and they have a little extra breast tissue there. It's called gynecomastia. There are some medications that can cause gynecomastia or extra breast tissue in men. Most of them nowadays, we don't use some medications for antacids and different things like that, like tagamet and cimetidine, that we don't use anymore. Marijuana can sometimes cause gynecomastia. It's very rare, but there can be tumor in your pituitary gland, which is back in your skull and helps regulate your glands and hormones. But most of the time, and then also another one is if you work out and use anabolic steroids in the gym, then that can cause gynecomastia also. A lot of times it just comes from being overweight and having excess breast tissue there. So for men, it can be a very sensitive thing, and some men don't want to take off their shirts. Sometimes it just happens on one side, sometimes it happens on both sides. Most of the time, it's nothing you did, it's nothing you could do about it except surgery. And so what we do for male breast excision is we make an incision around the areola, around the dark part of the nipple, and then we take out all the tissue between the skin and the pectoralis major muscle, that muscle in men's chest, and then it all lays back flat. And so then instead of seeing this puffy tissue that looks a little girly, then you can see the edge of the muscle, and then it looks more manly. And so that's what we do in general in a male breast excision surgery.